Today I'll be talking about RSV, respiratory syncytial virus. Introduction to RSV. Researchers began working on a vaccine for respiratory syncytial virus after it was discovered in the 1950s and linked to severe respiratory disease in children. Dr. Maurice Hillman discovered respiratory syncytial virus in 1956 from a sample taken from a child with a respiratory infection. The virus was originally called chimpanzee coryza agent because it was initially thought to come from chimpanzees. However, it was later confirmed to be primarily a human virus. Respiratory syncytial virus was discovered in 1956 at the Walter Reed Army Institute for Research in Washington, D.C. RSV, or respiratory syncytial virus, was not created in a lab, but rather discovered in 1956 when researchers isolated the virus from a group of chimpanzees with respiratory illnesses at the Walter Reed Army Institute of Research. The causative agent of respiratory syncytial virus is the respiratory syncytial virus, a single-stranded RNA virus. RSV is a gram-negative bacteria. The morphology of respiratory syncytial virus can vary, but is generally pleomorphic, meaning it can appear in multiple forms. Spiritual RSV particles are typically 150 to 250 nanometers in diameter. Filamentous RSV particles can be 0.5 to 12 micrometers long and have an average diameter of about 130 nanometers. RSV particles can also be asymmetric. Current and future scientific research. According to the CDC, there are 2 new RSV immunizations available. Babies are protected by either their mother being vaccinated during pregnancy or a shot at birth or during RSV season. Either choice is very effective at preventing babies from being hospitalized. Symptoms of RSV. The symptoms of RSV does not come at one time. They show up in stages. Symptoms in infants include short, shallow, and rapid breathing, fatigue, nostril flaring, fever, runny nose, and congestion, sore throat, pneumonia, or sneezing. Symptoms in adults: headache, pneumonia, coughing, wheezing, bluish color of skin due to lack of oxygen, which is cyanosis, fast breathing, chest caving in, or lack of appetite. Do you know? Respiratory syncytial virus is a common respiratory virus that infects the nose, throat, lungs, and breathing passages. Diagnosis and treatment of RSV. RSV can be contracted by inhaling droplets from a cough or sneeze. Another way is touching a surface or person with the virus. RSV is diagnosed by a medical history and physical exam, blood and urine cultures with children who are very sick, lab tests that use nucleic acid amplification tests such as real-time reverse transcription, polymerase chain reaction, imaging tests such as X-rays and CT scans to check for lung complications, a lab test that looks for the presence of RSV in nodular secretions or other respiratory specimens. Most RSV infections go away on their own, and the treatment focuses on managing symptoms, resting at home and staying hydrated, taking over-the-counter medications like ibuprofen to reduce the fever, using treatments typically used for a cold, or in rare cases, receiving IV fluids, humidified oxygen, or mechanical ventilation. Incidence of RSV. 2 to 3% of infants under 6 months of age are hospitalized with RSV every year. Severe disease most commonly occurs in very young infants, including healthy babies without underlying conditions, adults ages 75 or older, and adults ages 60 to 74 with certain risk factors are at increased risk of severe RSV. Globally, RSV affects an estimated number of 64 million people and causes 160,000 deaths each year. So with that being said, RSV mostly affects infants and young kids in the African American and Hispanic population. Patient prognosis of RSV. RSV usually doesn't cause prolonged symptoms. Typically, it is what we call acute illness, which means you're sick and get well. People who have pre-existing medical condition that affects their lungs and heart, there may be some long-term issues that could even be permanent. Most people fully recover from RSV in 1 to 2 weeks. RSV is the leading cause of death in children under 5 years old, causing over 100,000 deaths annually worldwide. In the United States, RSV-associated deaths in children under 5 are estimated to be between 100 and 500 per year. RSV can also cause severe respiratory disease and death in older adults. In the United States, RSV-associated deaths in adults ages 65 and older are estimated to be between 6,000 and 10,000 per year. RSV can also cause more severe illness such as bronchiolitis, inflammation of the small airways in the lungs, and pneumonia, infection of the lungs. Follow-up care for respiratory syncytial virus depends on the severity of the infection and the patient's ages and health. Of special interest, I chose to do the project on RSV because it is a very interesting topic to learn about, and I have learned a lot of new information about RSV. Also, I'm going into nursing, and this topic fits in the category of the field of nursing which I'm trying to go in, which is NICU. And this is the bibliography and the sites I used for my information.